whenever you're ready.
I think she just called you again.
Me?
What's her name?
Sherry? Sherry Chauvin?
Did I send you a picture with all the
Okay.
numbers?
Trying to make sure it's spacing. Okay. So this is the perennial bone in the front here. I'm sorry, no, I'm so wrong. This is the perennial on the side.
Right.
Parietal. This is the frontal bone. This is the squamous part of the frontal bone, which is usually the forehead.
The ones are just their Facebook names.
The nasal bone is here.
That's her Facebook.
Inside of the optical canal, it's here. And inside the supraorbital tissue. Above here is the supraorbital margin, which is this part. There's two notches here which aren't listed, and those notches are the supraorbital foramen notch.
When you weren't supposed to do it, she didn't correct that.
Cephoid bone we already mentioned. The temporal bone is the one on the side. Is your temples. Zygomatic bone is this area also here. And inside of here is the maxilla, which is this area. And inside the maxilla, there's these two arches, which is the infraorbital foramen or foramen. This guy here hanging off the side is the mandible. The notches in the mandible are the mental foramen. This little protuberance here is called the mental protuberance. Inside the nostril is the inferior nasal concha. In the femur bone, this whole area inside is called the ethmoid bone.
The straight line.
We turn it around, and these are the sutras. The sutra that runs atop the skull is the sagittal sutra. The one that runs along the back part here is the lumbar sutra. Lambdoid. Sorry, I'm really bad at pronunciation. Lambdoid sutra. This part here are the peripheral bones.
Parietal.
Sure you don't want to do it, so I'm not mispronouncing everything. Parietal bone. Sorry, guys. I'm mispronouncing the world. The mastoid process is also back here, which is this area. Near the temporal bone. It's part of it. And I don't know if I mentioned the occipital again, but that's it. And then there's these little bones, which actually you can't see on this thing.
The ridges?
Yeah, can we?
Kinda. Like, I guess this would be the inferior nuchal line. Here. External occipital crest. Superior nuchal line.
Is that part?
You can kind of feel it. External occipital protuberance. Just this area, I guess.
And that's the inside. And then we go here. I'm going to remove the mandible. And then it gets us the maxilla again, which is in here. The palatine bone, or these little parts right here, which is similar to the word palate, which I remember it. The vomer is this little area here. You said the maxilla already? The
Yeah.
maxilla is that part. The cephoid bone is this part here. Right, pointing to the right one.
Sphenoid bone is going to be
This
this
outer part?
wing-shaped middle part of your skull.
This part.
You see like this orange line?
Mhm.
Like if they take it out, it literally looks like wings.
So is it this outer one? Or
No, this middle part.
Okay.
This outer part is the mandibular fossa.
Okay. Occipital condyle is this area.
Do you guys know the names of that?
Yeah, what else do we need on here? There's a ton of stuff.
All the foramens, basically.
Okay, the foramens are crazy long, but the first one is this one in the middle, which is the foramen magnum,
Yeah.
which we learned was another word for it is whole foramen, and then magnum is big. That's a good way to remember. And then all these.
Jugular foramen.
The jugular foramen is this one?
Yeah. Oh no, you take this hole here.
Okay. So that part is the jugular foramen. It's this hole.
Stylomastoid foramen is the one directly to the side, going laterally. That's going anterior
So what's that now?
out to the laterals.
This?
Not too far. Thanks. So this is jugular. I think this one. Styloid mastoid foramen. Carotid artery. No, carotid canal. Here. Foramen lacerum. Do I need to know that? Foramen lacerum.
When we went.
Foramen spinosum. Foramen ovale. Maybe that's it. No, this is foramen ovale. I guess it looks like an oval.
That makes sense.
Lacerum is here.
You guys, the 4 study guides online, the 2 that are the Excel documents, those are lab practical study guides. The 2 that are the other study guides are for the lecture exam study guides. Okay? So there's 4 study guides on there.
Mandibular fossa,
Celia?
temporal bone, or zygomatic process, pterygoid process,
On lab practical,
sphenoid bone,
on lab practical one,
the maxilla here,
axillary, anti-cubital, and anti-brachial.
infraorbital foramen here,
That's gonna be on the practical.
and then the intermaxillary suture.
Forget it.